Good afternoon and welcome to our special Medicare webinar. We're thrilled to have you join us today. My name is Joyce Davis, and I'm the Outreach and Opinion Editor for Penn Live and the Patriot News. And I am just delighted to be here because, in addition to you, I'm going to learn a lot about a topic that is very important: Medicare. So, for those new to Medicare or those already enrolled, we know this is a very important and personal decision for yourself and for your loved ones. Over the next hour, we'll be hearing from a team of Medicare experts who will discuss Medicare basics, such as do you have the right plan to fit your needs, and what to consider when choosing your Medicare prescription drug plan. We will attempt to answer your questions after each panel, and we will bring all of our panelists back at the end of the program as well. So please submit any questions you have via our Q&A box on your screen. Just click that Q&A on the bottom of your screen, and to ask a question, type your question into the Q&A box. Then just click send. We'll see it. Please know all of your questions will only be seen by myself and our panelists. So don't be shy. You can ask anything you need to know, anything you want. The other thing you need to know is this program is being recorded. The recording will be emailed to you within 1 week, so you'll have the opportunity to rewatch, reabsorb all of the important information we will cover here today. Now, listen, we've got a real team of experts that are simply waiting right now to share all of their knowledge and expertise with us. So our panel today will include Spencer Fassini. He is Senior Inside Support Representative at Vibra Health Plan. We also have Hal Hawk, who's Director of Broker Operations at Unity Advisors Medicare, and Michelle Schwartz, Medicare Producer and Sales Compliance Analyst at Capital Blue Cross. And of course, this event would not be possible without the support of our sponsor, Capital Blue Cross. For more than 80 years, Capital Blue Cross has served Central Pennsylvania and the Lehigh Valley by offering health insurance products, services, and technology solutions that provide peace of mind to consumers and promote health and wellness for its members. They deliver innovative solutions through a family of diversified businesses to create healthier futures and lower healthcare costs. Additionally, Capital Blue Cross Health and Wellness Centers provide in-person service and inspiration to help people reach their health goals. So again, thank you everyone at Capital Blue Cross for supporting this really important conversation we are going to have today. Now, the other thing I need to make you aware of is this past Sunday, the Patriot News published a special Medicare guide, which is available also online at pennlive.com. Now, in that guide and online, we cover some of the new developments seniors face because of COVID-19. We list benefits and features of the 9 largest Medicare Advantage plans in the area. There's also a guide to Medicare.gov's Plan Finder, a key resource for you to use to make cost comparisons. Now, we think the guide is a valuable resource for you, so please be sure to take a look at it. It's got loads of information you will find useful. But right now, I think we're ready to step into our discussion. And for that, we're going to now just give you an overview of Medicare basics for those who may be first timers. But look, it's good for all of us to be refreshed about just what's going on with Medicare. So joining me now is Hal Hawk. He is Vice President of Broker Operations at Unity Advisors Medicare. Hi, Hal. How are you today? Now, Hal has enjoyed working in the Medicare field for more than 15 years as a national and regional Medicare sales broker manager. Hal, thank you for being here. Thank you for joining us today. Hal, are you there? Okay, I think we may have a little bit of a problem. Let's try to get Hal on the line. Maybe he is muted. Hal, are you muted?
Okay.
All right, there you are.
Can
Great.
we? We're
Yeah,
good to go. Okay. My apologies. So
that's all right. We got you now. That's what's the matter. But basically, we want you to step in and help us
yes.
get those Medicare basics. So, since you're the expert, help us to understand what makes a person Medicare eligible.
Eligible. Okay, let me just start by saying to all of our participants and anybody joining, I'm going to be talking about the part of Medicare which we call original Medicare. That's the red, white, and blue card that you may have or you may be receiving in the near future if you are going to be going into Medicare. So it's that red, white, and blue card that has the parts A and B on it. And just as an overview, Medicare is a federally sponsored individual health plan, and it's only for medically necessary procedures. And along with original Medicare, there are costs. You're going to have copays, coinsurance, and you will have deductibles. So let's talk about who is eligible. So anybody who is 65 years or older and has participated in Social Security or the Railroad Retirement System or the federal, state, or local governments or their spouses are eligible for Medicare. There are some who are eligible if they are under 65 and if they have been awarded Social Security benefits due to a disability on their 25th month of being considered totally disabled, they will automatically qualify for Medicare Parts A and B. Also, if you have Lou Gehrig's disease, ALS, or if you have end stage renal disease, those who are on kidney dialysis, you qualify for Medicare. You qualify for that red, white, and blue. Okay.
We got it. I
So
got it. It's either over 65 or if you have some of these medical conditions after a certain period of time, right?
that is correct. So it's not just those that are 65 years and older.
Right.
There are many people that are under 65 that do qualify and do take advantage and participate in original Medicare.
Okay, let's just imagine, for the sake of imagining, I'm over 65.
hmm
How would I go about signing up and becoming eligible, to enroll? What would I need to do?
Okay, so we're going to go over a couple scenarios here. If
Okay.
again, if you're collecting Social Security retirement benefits, um, you'll automatically be signed up for Medicare Parts A and B when you turn 65. But this is what we do know now, that so many people are working past 65 and are not collecting their Social Security until upwards of age 70. So those people would not automatically qualify for a Medicare. So they need to sign up on their own. So
Mhm.
the best way that they can do when they're not signed up automatically is to call the Social Security Administration office. And let me give you the phone number for that, and I'll give you a website as well.
Mhm.
If you are getting ready to go into Medicare and you're not automatically going to be qualifying for it because you are not collecting Social Security, you can call 1-800-772-1213. Let me repeat that. It's 1-800-772-1213, or you can go online and you can sign up for Medicare as well through SSA at www.ssa.gov. Again, that's www.ssa.gov.
I put it in
Or,
the chat there. Give me the number again. I'll put that in the chat there for
okay,
everyone too.
it's
1
it's
800.
1-800-772-1213.
Uh-huh.
1213.
1213.
Is
Okay, I'm
that
putting that there so people will have
okay?
it. But
And if you want to make an appointment, you can actually go to your local Social Security office and you can sign up in person. And that's if you have if you have some moving parts, as I would say, it's oftentimes a good idea to consult with someone at SSA to get all the specifics, and they'd be more than happy to help you and guide you in the right direction.
Okay, now look, we know timing is everything when it comes to Medicare and all this, but
hmm
just explain to me and make sure I understand what happens if I put off this enrollment? I miss whatever this window is now. Are there
Okay.
penalties? Can you talk a little bit about timetables here?
Sure, Joyce. So
Mhm.
let's review this first. And again, this is for original Medicare. If you are getting ready for Medicare and you're 65, there is what's known as an initial enrollment period. And this is for folks who are turning 65 and they are not collecting. Again, I'll say that again. They're not collecting Social Security or railroad benefits. There's a 7-month window in which you can sign up. And it happens to be 3 months prior to the month that you turn 65,
Mhm.
the month that you turn 65, and then 3 months after it. So there's a 7-month window. So, for example, in the not too near distant future, I will be Medicare eligible. And, in 8 or 9 years, I'll be eligible. And my birthday happens to fall in December. So I could enroll in Medicare 3 months prior to it, the month of December, or 3 months after it. If
Mhm.
I sign up for it 3 months prior to it, my effective date will be December 1st. If I wait until December to sign up for Medicare, my effective date will be January 1st. So sign up as soon as you can to make sure you are not delaying your Medicare. And this is important. Why? Because as Joyce just alluded to, there may be some penalties. So, what you want to do is to avoid these penalties, sign up as soon as you can. Now, if by chance, and I'm get, if by chance you do miss that enrollment period, there is what's known as a general enrollment period in which you can sign up for. It happens to run from January 1st through March 31st of each year. There's a possibility of signing up then. Please try to avoid this. Why? Because if you sign up in the general enrollment period because you missed your initial enrollment period, your effective date will not start until July 1st. Let me repeat that. There is what's known as a general enrollment period for those who have missed their initial enrollment period. It runs from January 1st through March 31st. Your Medicare does not start until July 1st of that year. So, why is this important? Joyce asked the question. There can be, and oftentimes there are, penalties for those who do not sign up for Medicare Part B, especially when they are first eligible. Let me just backtrack just one moment. When you turn 65, you will automatically qualify for Part A as an apple. And this is an entitlement. It's an entitlement that you have earned if you or your spouse have worked 40 quarters or 10 years. So you or your spouse have worked and paid into Social Security for 40 quarters or 10 years, you will be eligible and automatically qualify for Part A um, when you first turn 65. Part B as in boy, and we'll go over the parts in just a few moments.
Okay.
Part B, you do not have to sign up for. It's not mandatory, but it does make sense to do so. So let's go over a couple penalties if you do miss your enrollment periods. So if you do not sign up for Part A when you are first eligible and you decide to go into Part B through Medicare later on, Medicare says that for every 12 months that you did not enroll in Medicare Part B when you were first eligible, there is a 10% premium penalty that you are going to pay as long as you are in Medicare. And this is a penalty that you pay each month. Okay, so right now there is a cost for Part B. I'm not going to get into the weeds with this. There's a cost. In 2021, the cost for Part B will be $148.60. If you go a full year, 12 months without signing up for Part B when you were first eligible, you will incur every month a penalty of 10% of that. 10% of $148. It's nearly $15 you're going to pay in additional. Okay.
Um,
There's also, and we haven't gone over the different parts, but there's a penalty also if you do not sign up for Part D, as in David, or your prescription drugs of 1%. Now,
okay.
go
That,
ahead,
I
Joyce.
I think that makes sense. But the one thing I think we want to clarify here is there a difference if I'm still working and still having insurance through my employer and that kind of thing? Is there a difference there about when I'm supposed to sign up?
There is. So, this
Mhm.
is what we know.
Okay.
If you are working past 65, or your spouse is working past 65, and the employer, as Medicare says, has more than 20 employees, you are not required to sign up for Part B. You can delay your Part B um, until you retire. So
Mhm.
if you have employee group health coverage, then you are not required to sign up for Part B as in boy.
Okay, that
Okay.
explains it. But you're automatically signed up in Part A if you're taking Social Security in any form.
If you, yes, and if you
Okay,
or your spouse has worked 40 quarters or 10 years, it's an
right.
entitlement. It's an
Sure.
entitlement. You have paid into it through FICA taxes
All right.
throughout your career.
Let me throw another question here at
Sure.
you. We have one from one of our listeners, and it says Brian is asking, can an active employee be in an HSA plan in the year they turn 65 years old? Example, presently in HSA and will turn 65 in November 2020. Can I be in the plan sorry, he's going to turn 65 in November 2021. Can he be in the plan in 2020 is his question.
If he qualifies for both parts A and B, yes, he can participate in a health savings. Yes, he can.
All right, so that's not a problem for him.
It's
Anything
not.
else? Any other caveats he needs to know about how he can use that money, or when he has to stop doing that?
As a general rule, there are a few people that decide to go in that direction as opposed to taking on, and we'll talk about this, I'm sure, later on, either going into a Medicare Advantage plan or a supplemental or Medigap plan. That's another option in which, Medicare is going to give you a stipend, if you will, of each month for you to put into an HSA account. It's an account that you own the money. It is portable. It lives with you, and you pay your medical expenses out of it. You do need to be qualified for Medicare to participate.
Got it. Got it. Now, thanks so much for all of this. This great look. This is complex health, so you're really
Yes, it is.
helping
Yeah.
us think through because one slight change in your status can mean everything in Medicare. It sounds like. But
Eh,
let me just tell our viewers if you have questions, please do type them in for Hal, and I will make sure that he gets it, or we will use it and answer them at the end of the program. But go ahead, Hal. You were going to add something.
Yeah, I just want, and if we are finishing this segment, I just want to remind people that we are now in the what's known as the annual enrollment period for those who are in Medicare now to make any kind of choices that they want to. And do not take your Medicare lightly. As I describe it, unless you are making a large purchase during the course of a year, perhaps if you are buying a house or a large ticket item like a car, this may be the most important financial decision that you make each year. Paying for your Medicare, paying for your health care. So it's important to sit down with someone who knows all the ins and outs, knows all the parts of Medicare, is able to help you as an advisor to make a prudent decision. Again, it could be the most important financial decision that you make during the course of the year. That's why we at Unity Advisors Medicare are here to help you.
I see. Now you've done quite a bit to clarify things, but I have to. One thing you talked about was the penalty. The
Yes.
penalty, but you're talking financial penalty. But there's another penalty I'm hearing. We're in the middle of a pandemic. If you're going to sign up and not have your coverage start for a few months, that could be a disaster, right?
It could be, and again, you do not want to go. So we talked about a if you go 12 months without signing up for Part B when you were first eligible. Again, you are not required by Medicare to do so. Some people decide not to. I don't know why they wouldn't, but if you later decide to, there is a penalty. I think we'll talk a little bit during this conversation about the parts of Medicare, and one of them is the Part D, and Michelle will be talking about that. There is a penalty that comes up much quicker for your prescription drug. Medicare says you do not have to enroll in a Medicare Part D prescription drug, but if you don't and you later decide to, and you do not have what we call creditable coverage, creditable, that's CREDITABLE coverage. And Medicare defines it as coverage that is at least going to pay out as much as original Medicare puts forth in their model. So you only have a 63-day window there to sign up for a Part D plan. And if you don't, there is a 1% penalty that you're going to pay each month. It's 1% based upon the average cost of a Part D plan, and it happens to be about the penalty happens to be around 40 cents per month. So if you
Got
go a
it.
long period of time, you could incur some penalties. So again, Medicare
It can
says
cost
certain things you don't have to participate in, but if you don't and you later do, there are penalties.
It can cost you. So look, Hal, you've been kind enough to share your contact information too, I believe, on the screen,
Hmm.
right? So
Yes,
look, everyone feel free to reach out to Hal directly for more guidance. Of course, you can put your questions here. And the Medicare guide that we have in Sunday's paper should be helpful. But sometimes you want that personal information. Your case is not like everybody else's cases. That's what the benefit is of reaching out to someone like Hal to kind of guide you personally along this process. I got just one more thing to throw at you, Hal, and that is
sure.
tell me a little bit from your perspective of how COVID-19 has impacted all of this. I mean, we talked a little bit about if you're going to be not having insurance for a few months, but
Mhm.
is there anything else we need to be aware of as how COVID-19 has impacted Medicare?
Well, we live in a very trying time. It's a crazy world that we live in right now. And this is what we know. Generally speaking, when people that are Medicare eligible, want to sit down with an advisor or want to speak to an expert like Spencer or Michelle at a particular health plan like Vibra or Capital Blue, typically it's done in person. The health plans have made some arrangements to meet remotely um, so that you do not have to meet in person. So don't feel as if you're a beneficiary and you want to make a change and you are not comfortable with having a representative come and meet with you in person, reach out to the plan, reach out to Unity Advisors Medicare for that matter. Reach out. We have means of meeting remotely and giving you all the information you need and then to help you to enroll in the plan that best suits you.
That's a thank you. I'm glad I asked that. That's an
Yes.
important topic because we're talking about people who are over 65. We're talking
Hmm.
about people who may have underlying conditions. They're going to be
Correct.
reticent about going into someone's office. So it's good to know you can do that remote connection there. Well, look, I want to thank you. This has been most enlightening, and they know how to reach you if there are other questions. We still have time to get questions here, but we're going to have to move on to our next topic now that we have at least a basic understanding of the Medicare basics, right? So thank you, Hal. I appreciate it very much.
Oh, my pleasure.
All right. Now, panel two, this is what we're on to now. And this is do you have the right plan to fit your own specific needs? Now, as we know, Medicare is really not a one size fit all. I wish it were, it would be so much simpler. Or maybe I don't wish that. But anyway, I'd like to invite Spencer Fassini to join me and to help shed some light on how to choose the right plan to fit your needs. Spencer, howdy. How you doing there?
Oh, it's just living the dream over here, Joyce. It's great to be online with you today.
I know that. Well, Spencer has been a member of the Vibra Health Plan team since the company's inception in 2016, and he now functions as senior insurance sales representative for both Capital Blue Cross and Vibra Health Plans. Where among his responsibilities, he educates the Medicare beneficiaries, like the people that we are on this webinar. So Spencer is equipped to offer plans ranging from Medicare Advantage, HMO, PPO, Medicare Supplement, Medicare drug prescription plans, as well as so much more, dental, vision. So welcome, Spencer. Let's get right into it. I think the question that's on everybody's mind is where do we begin? Are there some guidelines or anything that we can ask ourselves to point us in the right direction in choosing Medicare coverage?
Absolutely, Joyce. There are a few preliminary questions that you should ask yourself in order to narrow down your choices to make a more informed decision. They are presented on the screen right now. So just starting with number one, how often do you think that you visit the doctor in general? Whether you're visiting the doctor one time a month or one time a year, there's going to be Medicare plans that are available to meet your needs. Ultimately, the decision is going to boil down to financial probabilities based upon how frequently you think that you're going to need either hospital or medical services. And regardless of the plan option, there are a plethora designed for people of all walks of life, whether you're an individual with low income, or whether you have chronic conditions, or whether you're completely healthy. So there's plenty of plan options available.
Your audio is a little bit off there. Is there something maybe it's your headphone? That could be it. Let's see.
How does this sound, Joyce?
It sounds a little bit better, but it's still kind of echoey. I don't know. Let's see.
Echoey. Well, I can try it like this. Is this any better?
That's better. Go ahead with that. Continue. Sorry.
All right. So would you just like me to repeat?
Yeah, please do. So everybody gets what you've been saying.
Absolutely. So just re-summarizing what I said earlier was whether you're going to the doctors very frequently or very infrequently, there are going to be options available to meet your needs. If you're an individual who goes to the doctors and you have chronic conditions like diabetes, or if you're low income, or if you're completely healthy, there are going to be plans available to meet your needs. And making that decision is just simply figuring out how often you're going to use medical services and then going from there. The next thing that individuals have to take into consideration is the provider network. Oftentimes, whenever you're going on a Medicare plan, you have to take into account whether or not your provider participates with your health insurer. With the growing popularity of TPO plans, provider network is becoming less important, and a TPO plan is called a preferred provider organization, and they're essentially health insurance plans that allow individuals to use doctors or hospitals who are either in or out of the insurer's participating network. If you go out of network, you generally incur higher costs. In contrast, there are what's called HMO plans, which are health maintenance organizations. And in HMOs, you need to use in-network providers for all diagnostic and non-emergency care services. I've worked with individuals who don't care about their providers participating in the network, but more often than not, individuals want to stick with their doctors. So shoppers can always provide or can request a physical provider directory, or they can go to the health insurer's website in order to look up their providers online. Mm-hmm. I have the audio hanging in there, Joyce.
Yeah, it's better. It's not perfect, but at least we're hearing you and we're understanding. Just as I say, a little echoey. That's all.
All right. I do apologize.
That's all right.
I don't think it's my bad. And then the third question down is, how is your health in general? Has it changed recently? Did you receive a new diagnosis? Do you have any surgeries coming up? Luckily, individuals who are on Medicare have the ability to change health insurance plans at least once a year during the annual enrollment period, as Hal noted earlier. And the annual enrollment period is October 15th through December the 7th. And you have an opportunity to make a plan election switch for January 1st of the following year. Individuals also have an opportunity from January 1st through March 31st to enroll in a Medicare plan. It's called the open enrollment period, where you can make a one-time switch in the event that you weren't happy with the election you made during the annual enrollment period.
Right.
So you can assess your needs on an annual basis, and sometimes even more frequently if your health status changes. Then moving down along, the fourth question would be, do you have other health insurance through an employer or a spouse?
Right.
And this is actually a very common theme that I find working with potential Medicare beneficiaries. And the question I ask is, if you do have an employer group health plan through a spouse, or if your spouse is on your employer plan, I ask, Do you think that you need Medicare and an employer group plan? Do you think that that's too much insurance? Frequently, people who have an employer group health plan will do what's called deferring Medicare Part B, and Hal alluded to that earlier in the conversation. Because Medicare Part B does have a premium associated with it, you don't necessarily need an employer group health plan and to be on Medicare at the same time. Sometimes, though, individuals accept Medicare even if they do have an employer group plan because they find that Medicare benefits can in fact be richer sometimes than their employer group plans, and sometimes even cost less. One thing that you do have to keep in mind, though, is if you are an individual who has an employer group plan and your spouse is on your employer group plan and not yet Medicare eligible, your spouse will have to retain an not employer coverage, but they will have to retain some sort of insurance coverage once you leave your employer group plan. And you can obtain an individual insurance policy through a private insurance company, and sometimes even your employer may allow them to stay on, but that's fairly infrequent.
But basically, in this, the person has to simply compare both of them. What am I getting with Medicare Part B? What am I getting with my employer plan? Compare, and then what are they costing, right? Compare the cost.
That's exactly it. That's exactly it, Joyce. And it does boil down to the finances behind it. You know, how much are your co-payments? How much are your monthly premiums? Cost, convenience, those things are very important whenever you're making this sort of decision.
While we're here, this is very interesting to me. Let me just ask you one question while we're here. In general, do people end up saying, no, I'll leave the employer plan and go to Medicare because it's just so much better? Or do most people believe that their private insurance is providing them more of a service for cheaper money?
Well, I do frequently find that people with employer group coverage have a wide variety of options available to them. So it is a little different. It's comparing more apples to oranges in that situation when you have an employer group plan sometimes. And there's other variables such as, are you covering family members, dependents, spouses, that sort of thing. But individuals generally I find who have just an insurance plan by themselves, not through an employer, they typically always benefit from going onto Medicare as opposed to retaining that individual policy because the cost is so substantial.
Yeah, there's a little scratching going on now. I don't know if you want to adjust your microphone again, maybe this, just a little bit, maybe. Okay. All right, let's try. So go on to the next point. I think I'm pretty clear on that one.
All right, excellent. Number 5, we're good?
That's better, yeah.
Good. Mm-hmm. All right. Do you have retiree health coverage through a union, military, or a former employer? This one is not as popular anymore because fewer employers are paying for retiree coverage. But if you do have an employer who does, you are very lucky and very fortunate in those situations. I always pose the question to individuals, if you are shopping for an individual Medicare plan, you always should consult with your human resource benefit administrator to make sure that if you leave your employer coverage, you got to make sure that if you don't like the new coverage, that you can return. Oftentimes, you are prohibited from returning if you choose an individual Medicare plan. So it's always important to communicate with that group benefit administrator.
I see. Okay. So check that out because you don't want to get out of it and not be able to get back into it if you want to. Yeah. Truly.
And they are truly a benefit. I often find that employer group plans are truly very rich in benefits. Mm-hmm. We'll move along to question number 6 to wrap this up this section. Do you live in a long-term care residence or nursing facility? Some individuals who live in these facilities are subject to certain health plans, and they can only select certain health plans due to network constraints. So if you do live in a skilled nursing facility or a long-term care facility, I consult with your administrator, the location's administrator, or you can consult with individual health insurance plans to see if we do participate with your long-term care facility or skilled nursing facility. Network is incredibly important whenever you're considering question number 6.
Very good. Well, you know that, and now I see how why it really depends upon your situation. Why there can't be a one size fits all. Even though I wish that we all wish it were simple, life's conditions make it complex, and you just have to think through these things. But let me give you one question that we have gotten here. Uh, Seidel says he or she is 69 and enrolled in Medicare A. He had employer provided health care until June of 2020. Then the job was eliminated due to COVID-19. There's that COVID-19 again. He enrolled in his wife's employer provided health care. When will he be required, he wants to know, to enroll in Medicare B to avoid any financial penalties? I think I know the answer, but I'm going to let the expert go. Tell him, does he have to?
Oh, Joyce, I'm almost interested to hear your answer. So, from what I assessed from the question there, I'm assuming that he picked up his new insurance once he lost his insurance, so he is currently covered. Is that correct, Joyce?
He's currently covered with his wife's plan.
Right. So it does not sound to me as if he has to leave that employer coverage until his wife retires. At which point, he would want to reach out to Medicare or Social Security rather to activate his Medicare Part B so he does not have a lapse in coverage.
Very good. But you can see how a lot of COVID-19 is putting a lot of people in very different situations that can have an impact on Medicare and when they're eligible and when they need to be making some of these decisions. I would assume you would say everyone right now, whether they're employed in an employer plan or not, should be thinking through these things each year, correct?
I agree, absolutely. And that's why you have the annual enrollment period each year to assess these needs.
Very good. Very good. Well, you know what? We've really clarified a lot of these issues. I'm not sure I think, I don't want to say I'm an expert now, but I've now gone through the basics and now we've got these special complex cases. So things look a little bit clearer to me. Is there anything else you really want to emphasize and make sure that our listeners, our readers understand what's going on here?
Well, I'd just like to extend the fact that whether you're calling Vibra Health Plan or Capital Blue Cross or even HAL over Community Advisors Medicare, we're in such a regulated industry that no one is trying to sell a product or push something on you that doesn't meet your needs. There are so many options available out there that you can just give any of us a call, and we'll be more than happy to provide you with some guidance and point you in the right direction. Ultimately, we just want to make sure that you have a product that meets your needs.
Wow, that's great. And there I see on the screen, there is a number you can call. There's the website for Vibra Health Plans. And Spencer has just offered to personally guide you through any particular issues you might have. So Spencer, thank you so much for taking the time to share your expertise with us today.
Thank you, Joyce. You have an excellent day.
Great. Have a great day. Well, you're going to hang around because we have questions at the end. But now, guys, we're on to an even more in-depth discussion of the complexity of Medicare, and that is choosing the right prescription plan. Oh, that is so important. Medicare has an optional program called Medicare Part D. It provides insurance to help you pay for prescription drugs. And thank goodness we have Michelle Schwartz here to try to help us think through these another complex issue, right? That is part of Medicare, but one that we really need to think through. So welcome, Michelle. How are you today?
I'm doing very well. Thank you. Appreciate having me.
Absolutely. Michelle is Medicare producer and sales compliance analyst at Capital Blue Cross, and she's going to explain how the program works and things to consider when choosing a right drug plan for your particular needs. Michelle has been working in Medicare at Capital Blue Cross for 19 years, and her Medicare career began in the customer service area of Keystone Health Plan Central, a subsidiary of Capital Blue Cross. Michelle enjoyed the experience of working with the senior population, and with the knowledge gained from her customer service background, she transitioned into Medicare sales. So Michelle currently works in the Medicare sales operation, where she's responsible for department policies, compliance oversight, agent training, and she acts as a department liaison subject matter resource for Medicare and CBC Medicare plans and products. Michelle, you've got a lot of responsibilities, a lot on
Keep
your
me
plate.
busy.
Absolutely, absolutely. So you're the right person to have for this discussion. So, I guess the first big questions are, what is Medicare Part D? You can kind of lay it out for us. And how do we get it?
Okay, good question. So Hal kind of alluded to it, but Part D is actually just its prescription benefits, prescription drug benefits offered to anybody who has Medicare Parts A or B. It is a voluntary coverage, so you don't have to enroll. However, in order to get a plan, you actually are going to have to enroll through a private insurance companies that have contracts with Medicare to offer the Part D drug coverage. And there's two ways you can do that. You can get what's called a standalone drug plan. So if you just need to add drug coverage for your Medicare coverage, you will actually get enroll in a Part D drug plan. If you choose to enroll also in a Medicare Advantage Part D drug plan that Spencer alluded to, that way you can have your medical and your drug coverage all together.
I see. So you have the option of just getting that drug part or wrapping it into the Part B.
Right. If you were going to stay with original Medicare, so to speak, and maybe take a Medicare supplement, and you just wanted to add drug coverage, you would just enroll in a drug plan. If you wanted to put everything together, your medical and your drug, the Medicare Advantage plan, you'd look for one that had the drug coverage included.
And let me get this straight. I don't have to get it. It's not a requirement. I got to be forced to take that drug plan if I don't want to.
That is correct. As a Medicare Part D is a voluntary coverage, so you do not have to enroll. However, it is sort of recommended that you do enroll in a Medicare drug plan if you don't have any other type of coverage that would be considered credible, which just means that it's as good as the Medicare Part D coverage. So if you're not working or have other type of Medicare prescription coverage, you would want to consider to enroll, because if you don't enroll when you're initially eligible and you choose to enroll in a Part D drug plan later, you will likely incur a penalty. Again, Hal alluded to this.
Oh, wow.
That penalty again. And that penalty is added to your drug plan premium for as long as you would have a Part D drug plan. So it doesn't go away. And also the other issue you'd have to be concerned about is if you don't enroll when you're initially eligible, you may have to wait to actually be able to enroll in a plan, which means it's even longer till you're able to get a drug plan. And also that penalty might start, incurring more. So you do want to consider. And also individuals who do have Medicaid, like full Medicaid benefits, those folks, if they want to continue to have their drug coverage, they will need to enroll in a Part D drug plan.
Okay. All right. So it sounds like some people really should do this, but do most people opt to enroll in the Medicaid drug plan, a Medicare drug plan? Do most people go that route?
Yes, they actually do. I think they really do. Unless they currently are working, have coverage through an employer, or a spouse that has coverage through an employer, they generally do enroll in the Medicare Part D of some, form or fashion when they are eligible. So yes, I think most people do.
Listen, I think Chris wants to clarify. She really wants, again, us to repeat the difference between Parts B and D. Now, I think I know it, so tell me if I'm right.
Okay.
Part B could have D, but it might not have D. You could have D separately, and D is the drugs, right? You can do it better. Go ahead.
Well, not exactly. Part B, as in we'll say boy, just so you can, tell, is actually a part of the original Medicare. That's your medical benefit. So that would be your doctors, your outpatient services, lab work. Medicare Part D, as in drugs, is going to be your drug benefit. You might be thinking of there is Medicare Part C, is what they actually call the Medicare Advantage program, where you could get the medical and the drug benefits put together, like the HMO or PPOs that Spencer spoke about.
All right, so Michelle, let me make sure. So this is for Christine. I'm going to make sure I have it. There's the basic, which is your automatically enrolled Part A. When you turn 6, that's an entitlement. Then there's Part B that you have to make an effort to do under certain circumstances, right?
You may have to enroll in that as well, yes.
Exactly. Now, C could be a combination of Parts B and the drugs.
Actually, it would be a combination of A, B, and possibly D. So Medicare Advantage plans are just another way that a beneficiary can get their Medicare benefits. So rather than Medicare actually administering the benefits to them, Medicare contracts with private insurance companies like they do for the drug benefit to administer the Medicare benefits. So rather than having Medicare pay your claims and so forth, everything is being handled through that Medicare Advantage plan. And those plans can, again, they're going to have to include the Part A and the Part B benefits, which is like your inpatient hospital. Part B is your outpatient and your medical and your doctors. And then they may also include Part D drug.
Right,
Does
right.
that help
Now,
clarify?
I think it's you can see how unless you're in this all the time, all this vegetable soup can really be complex, but I think it is clear. Now, you talked also about the penalty. And how much is that penalty? Is it a lot to worry about if you don't do the D?
Well, the penalty is calculated as 1% per every month that you didn't enroll when you were initially eligible or you go without creditable drug coverage. So it's 1% times Medicare comes up with a base premium every year for the Part D. So that penalty is calculated times that percent, that particular premium added to your premium whenever you enroll in Part D. You won't have the penalty assessed unless you're enrolled in a Part D drug plan. So, but that does stay with you as long as you're enrolled in a Part D, and also that base premium that Medicare sets every year, like a national base premium, that also tends to increase every year. So your penalty can actually be increasing every year. So it's 1% for every month that you were not enrolled. So it could be small or it could be substantial if you waited a year or two.
Sure, sure. Now, we've also heard that about the extra help coverage. What is extra help and how do you qualify?
Extra Help is a program that Medicare has to help individuals who basically have maybe limited income and resources to pay for their Medicare Part D prescription costs. So it can assist you with your premium, the deductibles, the co-pays. So it'll lower your costs for those. It also gives you coverage in the coverage gap. And the way that you apply is, again, this situation is based on income and resources. So there are different levels of extra help that you can qualify based on where you fall with those particular things. And you would contact Social Security to see if you qualify. There are some individuals who will automatically be enrolled and qualified for the extra help. Typically, if you're on Medicaid, or if you're getting help with what they call Medicare savings programs. There are some programs that help individuals pay for their Medicare costs, like their Part B premium. So those folks will automatically qualify. Anyone else can certainly contact Social Security to see if they qualify. You don't have to just do it when you're first eligible for Part D. You can enroll, you can apply at any time, because sometimes you might not have qualified initially. Maybe you were still working, had, your salary, but now you're strictly on Social Security or pension benefits, and your income financial situation has changed. So you can always reapply.
Right, right. You should always be assessing. All right, so here's the other big question that's out there. Okay, how do I choose a plan? What do I do to begin this process of choosing this drug plan?
Well, choosing a drug plan is probably one of the most daunting parts of I think, beneficiaries making their decisions every year. So what you're going to take into consideration, of course, is what are your needs? So are you taking medications? What type of medications are you taking? But when you're looking and comparing plans, you don't want to just take into consideration the premium or the deductibles. You want to look at the actual overall cost of your medication. So Part D plans can vary from plan to plan as far as what their copays are for drugs, which medications they cover. That's called their formulary list. Formulary list essentially is just a list of the drugs that they cover. So you want to find a plan that covers your medications. You want to take into consideration, do they have a deductible? What are my copays going to be? If you're going to be looking at a Medicare Advantage plan, you'd want to look, of course, at the other parts as far as the medical benefits and what others, maybe additional benefits you might get, such as dental or vision or fitness. But the drug cost is really going to be the key thing. And you want to be looking at what your co-pays and co-insurance is going to be over the course of the year. Great tool for that, because it can be overwhelming. There are a lot of plans out there. There's several Part D drug plans. There's many Medicare Advantage plans to choose from. So Medicare has a great tool called their plan comparison tool. If you go to medicare.gov,
Medicare.gov, and it's a plan comparison, right?
Yeah, there's a plan finder tool that you can click on, and it's a wonderful tool. So what you can do is you would enter your zip code for where you live, so they find plans in your area. And there's certain questions they'll ask you. You can decide whether you want to look at a Medicare Part D drug plan or Medicare Advantage plan. You can even let them know if you have extra help, or if you want to pick particular pharmacies that you can go to see, that you can use. And then you will enter your actual drugs, each drug. You want to make sure that you're putting in your exact drug and dosage. That is an important element, because there are a lot of medications that have different alternatives out there. So you want to make sure you're putting in your exact drug and dosage. And then it will come up with a list of plans that you can use to compare.
Right.
And what's even greater about that is you can do comparisons with different plans, but you can also look, it'll list your actual drug cost for the whole year. So it'll show you through a calendar year exactly what you're going to be paying, what your prescription cost would be month to month. It'll also tell you whether the drug is covered, what your copay would be in each of the coverage levels, which we didn't get to talk about yet. So it's a great tool. It's a way to narrow down your selection. And if you're not comfortable using like the internet or going to the website like that, you can call Medicare, 1-800-Medicare. That's an easy enough to
1-800
remember.
Medicare, and somebody will actually talk to you
And you can actually talk to a customer service representative who can help you walk through that. Again, you could also call and talk to a plan. You can talk to an agent, such as HAL. Prize is another organization through the Agency of Aging that helps to guide you with insurance healthcare decisions.
Sure. Now, Michelle, listen, what you're describing, really, I get why you can't just say, this is good for you and this is, because
Right.
it really is so personal. But what if things change for me during the year? Let's just say I decide on this, but suddenly I've got more medicine, or they're prescribing a different kind of medicine or whatever. Can I change in the middle of that, or am I stuck with this for a year?
Well, typically you will have to remain in your plan for the year, for the calendar year. But as this time of year, everyone does have the option to make a decision and change their plans if they want to. But typically you would be in the plan for the rest of the calendar year. If your drug needs change, there's options you can take a look at. If the drug's not covered, there's request for review to see if you can get the medication covered, called formulary request, or you can speak to your doctor and just see if you can work with him in the plan's list of covered drugs to see if you can find a drug that's covered. So typically, unless
go ahead. No, you go ahead. Typically,
you're in the same plan for the same year, unless you have some type of special circumstances. Those folks that qualified for that extra coverage, that extra help with the Part D drug plan we spoke about, they would be able to change once every quarter, except for in the first 3 quarters of the year.
Okay, very good. Now, you were mentioning just now there were levels of coverage or something that you said we needed to get to. Tell us about that.
Right. At the Part D, the way the Part D coverage works is it's basically laid out into stages of benefit. There's basically 4 stages of the benefit, and depending on what stage you're in might determine exactly what your cost is going to be, what you're paying for your drugs. So the first stage is the deductible stage. Now, not all plans have a deductible. Some plans will waive the deductible, but if they do have a deductible, of course, you'd be paying the full cost of the medications till you satisfy that deductible, just like you would with a auto insurance policy. After that's satisfied, or if you don't have the deductible, then you're going to go into what's called the initial coverage level. And then that's what we call kind of like the copay stage. So it works the way you typically would think. You go to the pharmacy or send in your prescription to the mail order, you're going to have a copayment that you pay, and then the plan picks up the rest of the cost of the drug. And that's how it would continue throughout the course of the year until you have spent your total drug cost, meaning your payment and the plan's payment combined reaches a certain dollar amount. And that amount is set by Medicare every year. So that's something that they determine, that initial coverage limit. And that would also be the same across the board with all Medicare Part D plans. So then you go into what's called the coverage gap. You may have heard that terminology before, or the infamous donut hole, they used to call it.
Yes.
When at that point in time, there actually was sort of a break in coverage. It's not really a donut hole or a total coverage gap, but now your coverage does change as far as your coinsurance. Now you're going to be paying 25% coinsurance for your brand or generic prescriptions. So your cost share has changed. And that will continue through the rest of the calendar year, unless your true out-of-pocket, your out-of-pocket cost you as the member are paying reaches a certain amount level that will roll you into what's called catastrophic coverage. Now that out-of-pocket cost is accumulating from the beginning of the year, your plan. So if you paid any deductibles, any co-pays you paid in the initial coverage level, your co-insurance that you've been paying, if that reaches a certain level, then you're in what's called catastrophic coverage.
Is it
which
capped? Is what you would have to pay capped at any point, or can it go on and on and on?
Well, it's not exactly capped. When you're ready to go to the catastrophic coverage, now you're going to be paying just a small co-insurance or copay for your drugs for the rest of the year, but that would continue to the end of the calendar year. So
When
there
it
is
all resets.
and it all resets January 1st, exactly. Whatever coverage level you end in, it all resets the next year. So you get to start all over.
Right all over and go through this process all over again. But Michelle, it really does look like you advise people to think through this every year, because things are changing, and what worked for you one year may not work the next year.
Right. There's two things. You may have changed your drug coverage, or your plan may have changed what drugs they covered. So that's the things. That's why you want to take a look at that every year. Take a look and see where you are with your drugs and what your plan's covering, and that's a good time to make a decision. So.
Well, look, guys, we've at least delved into this, and it's a little bit clearer. But you can see how these are experts; they study it all the time. But that's why they're here, making their expertise available, and also making their contact information available, so that you can really reach out afterwards and continue the questions. But why don't we bring our other panelists back on, because we have some other questions, maybe for the entire group. Our final questions we can have here. Does Hal and Spencer want to join us for this closing questions?
Fire away.
All right, listen.
I'm here.
A question came in, and I don't know who wants to take. They apologize, but it says, if I work past 65 and my employer provides medical benefits, do I still need to register for Medicare and Parts B and D, but opt out until I would actually retire from work, hoping to work as long as physically able to do so? Thank you.
So Joyce, this is Hal. I just sent an answer, but for everybody.
Yes.
So if you're working past 65, you can continue to work and not have to enroll in Part B as in boy. Chances are you already have Part A as an entitlement. You continue to work for your employer. As I would put it, if Medicare says if the employer has more than 20 employees, you are not required to enroll in Part B. So you can continue to work as long as you would like. However, it's always a good idea to check with your benefits administrator just to make sure. So again, if you're working past 65, you're not required to have Part B if the employer has more than 20 employees. But please check with your benefits administrator just to make sure. You certainly don't want to incur a Part B, that 10% penalty. So good question.
Good question, and also a good answer, because one of the things I keep hearing is that they can give us the advice and the guidance based on what they know, but there could be some little twerk difference in your situation that might actually, you should really consult someone who can really look specifically at your case. But thank you. Now, there's another question here that says, I am turning 65, September 2021. I'm a widow receiving late husband's Social Security benefits. She's self-insured. When can she start this process?
So I will field this as well. So June 2021, this is Hal.
Yes.
So let's do the math based upon what we talked about earlier on with the 7-month window, 3 months prior to the month of turning 65, the month of 65, and 3 months after. So in this case, June of 2021 will back up 3 months. And that will be May, April, and March. So you can start the process to have an effective date with Part A and B for June 1st. Start the process in March if you'd like.
Very
Now,
good. Go ahead.
Just to make sure, you said that you have benefits through your Social Security through your husband. If your spouse has worked 40 quarters or 10 years, then you are entitled to Part A, and you will not have to pay any extra for Part A, and you can take on Part B. Good question.
Very good. Well, again, it's a good question, and we've had some great answers here, and it just shows how much we really need to pay attention to this, especially as I think you pointed out, Hal, too, since we're in the middle of a pandemic, and so much is at stake here in making sure you have what you need for your medical care. So I want to thank everyone so much for joining us today. We do hope you learned something new and feel more prepared to take on your Medicare journey. I know I learned a lot. And I thank you again to all of our knowledgeable panelists, Hal, Spencer, and Michelle. And also, we want to thank our sponsor, Capital Blue Cross. Everyone, have a great afternoon. Check out that Medicare guide in Penn Live and the Patriot News, please. It'll answer questions and take advantage of the numbers and the guidance that's been offered here today. Thanks again now. See you soon.
Thank you.
Bye-bye.